Thank you for all you do.
Oh, you're welcome.
Thank you for all you do.
Oh, you guys are welcome.
You're watching out for me, baby.
Okay.
Lord.
What'd you make?
I made a face.
Yeah, you did. A lot of people ask me, how did I know? How did I find out? And I tell them I was lucky because somebody listened to what I said. I went to my primary physician. I mentioned to him that every once in a while I had like a feeling of pressure right here that was odd. They found blockages. So it was just a fluke that I mentioned I had this because I had no symptoms. I didn't feel bad. I mean, I'm still trying to understand the whole thing because it's been less than 24 hours since they told me. I've been going to doctors taking care of myself forever. And I knew I had the high blood pressure. I knew I had the high cholesterol, always been tested for it. And I did not know I had anything to do with blockages. I just assumed everything was okay in there.
I've asked that IMS be run.
So I think this is what is so sort of typical of Sheila's story, is that she never had chest pain. Not once has she ever in her entire life had chest pain. And so, Sheila thinks that, well, gosh, if I was gonna have something wrong with my heart, I must have had to have chest pain at some point in my life. But what I hear over and over and over again, especially with my female patients, is they don't have chest pain. And instead, she had very other sort of typical symptoms for someone that has heart disease. The fatigue, and she would get a little bit short of breath, and just generally she wasn't feeling well. The other thing that she told me is she started having throat discomfort, like a discomfort that she thought maybe, was it like acid reflux? Did she have a cough? Maybe it was something like that. But I think what she was feeling was actually her chest pain. I round in the hospital. I also see patients in clinic, and then I also am a cardiac imager by training, so I have days that I spend just looking at different types of imaging of the heart. So I'm kind of all over the place. And I wear compression stockings. That's my little secret.
You're here in a surgeon's office, obviously.
Yeah.
And we're talking about open heart surgery, but I just kind of want to run through what that means and stuff here. What we usually do to fix those bypasses is we usually take some veins from your legs and an artery behind your breastbone. We use these new blood vessels to reroute the blood past the blockages in the heart. It's like if there's a traffic jam out there, we move the traffic around the traffic jam. So we don't actually do anything to the blockages, but just reroute the blood around it. The 5 main risks of the surgery. Everybody afterwards has some bleeding, and we monitor that. There's a risk of infection. The risk of infection is about 1 to 2% of a deep wound infection. There's a risk of heart attack during the operation. That's about 1%. And there's a risk of stroke. And in your age group, tell me how old you are again. 70, okay. Your risk of stroke is about 1 to 2%. And the risk of you dying is actually less than 1%.
Okay.
Yeah. So I know these things, these are bad things we're talking about. I know they're bad things. But the benefit for you is a longer life and a better quality of life. And so when we think about the benefit versus the risk, that's what we kind of do in everybody. We check out things to make sure that the benefits far outweigh the risks. And so far from what I know of you, I think that's the case.
I don't know how you're supposed to know. It's just an accident, I found out.
Well, I think most people find out by accident.
Really?
Yeah, I don't think people don't come into the doctor's office and say, I think I have a blockage in my heart.
No, but on TV, it's just a pain in the arm, and and they collapse on the floor. But I guess it's not like that.
What causes a heart attack is an acute heart attack, is that blood flow is prematurely interrupted here. This is a plaque buildup, and what happens to plaque is it grows slowly over time. This artery should be all the way out to here, but what we're seeing is a calcified plaque that is impinging upon the blood flow to the front artery of the heart. the natural question, well, how long has this been going on for? And this has likely been going on for a number of years. In women, it can be very challenging. They can present with atypical symptoms, nausea, not feeling well, very odd-like symptoms, not the classic chest tightness or chest pressure. So who are the people that present atypically? Anyone who's over the age of 70, sometimes some people would say 65, diabetics, and women. Those are the three groups that will classically have different presentations. Anywhere from right arm pain to left arm pain to jaw pain to ear pain to one patient I had said that every time she'd walk, she'd start burping. And that was her discomfort in her chest. That was her manifestation of it. Fatigue is a very common one. There are many patients that present with tiredness that they blame on getting old. But in reality, it's heart disease underlying it.
Yeah, I mean, I know it's frightening, but it's not something you've done before, but it's something that everybody around here has done many times.
Well, thank you guys for coming today.
Love you.
I love you too. You guys don't have to stay out there all day.
We'll be out here.
Okay.
All right, we'll see you shortly.
All right.
Yep.
All right.
Behave.
We'll take good
Okay.
care of her, just like our own.
Here we are. Yep. Exactly.
So you know, we talked in the clinic how we would use some veins from our legs to reroute the blood past the blockages in the heart. So we're taking out the superficial veins, and these veins are such that you can deal without. In other words, that if we even take these out, the deeper veins will then take over the job of the superficial veins we're doing and still continue to take the blood back to the heart. I've been taking vein since 1987, but I've been doing this endoscopically like this since the year 2000. When we first were doing it, we used to make a big incision all the way up and down their leg, and that's something that was really brutal. I mean, as far as their recovery period and everything, so this has been much better. What I like about this kind of medicine is that you do something and you see like instantaneous results. They can give a drug, and 30 seconds later, there's a change in the blood pressure. What we do in here is like the surgery is 4 hours long, but it can be a life changer. It'll be a life changer for this lady. I mean, only when she gets over all this. This is the vein out in its entirety.
We're just getting new blood beyond where the blockages are. We can't stop the process of the disease. You know, that's something that hopefully we can do in the future. I'd say she's maybe has a little more disease than most people. Just more plaque, more blockages. Some of her arteries are small. You know, so that makes it a little challenging, and you know, we'll see once we get in there. You know, she should have a good lifestyle and definitely increase the length of her life.
Knock, knock. Hi.
Dr. Sharma.
Dr. Sharma. Yes, ma'am. Hey.
Elizabeth.
Hey,
Good to meet
Elizabeth.
you.
Nice
I'm her
to
daughter.
see you. Nice to see
see
you.
you.
Hi, Miss Caperton.
Hey,
You look good.
that's what they tell me. I can't. There's no mirrors.
You look great, dear. How you feel?
Pain, but they've been handling it pretty well.
So you know you had four vessel bypass.
Right.
So we,
A lot.
yeah, that's a lot. But we got you fixed up. When you get out of here, you know, within the next couple days, they will set up an appointment to see me in clinic. And so, you know, I'll see you a couple weeks after you get out of here. Somewhere between 8 to 12 weeks, depending on how you're feeling, we'll get you set up to go to cardiac rehab.
How you feeling? Good?
Yeah, feeling good. I mean, I can't breathe because this kid's pushing up against my
I know.
diaphragm. But besides that, I'm totally fine. Yeah, I'll tell you, the thing I look most forward to, besides, getting to meet my kid, is being able to breathe. Like,
Yeah.
I'm really... That's the real bonus to all of this. All right, dear. Well, you hang in there. You're doing great. Raisin toast, my favorite.
Coffee to go?
I'll have a little bit now. Sure.
I'd rather hear about her day than describe mine. Because hers is more interesting on the whole.
I tell him about the good stories, the bad stories, the really funny stories. I think, in a way, like, our job is, I don't know, I think it can be really emotionally intense sometimes. For me, the way that I deal with it is I come home and I talk about it with Greg. It's like therapy for me. It's really hard to carry that around. It's been great to be able to come home and have someone just listen. I don't know if it's just my personality. I tend to be a much more emotional person, but I feel it, with my patients. It's so funny, Robin, my nurse, is always giving me a hard time. She's like, are you running a cardiology clinic or are we running a psychotherapy clinic? And I'm like, both.
Yeah.
Yeah. This is a journey, and it doesn't just stop when we fix the immediate problem, right? This patient's gonna be having to deal with this, moving forward for the rest of their life. And so when we think about the Women's Heart Program in particular, really what we're trying to do is saying, yes, we can fix your heart attack, your valve, whatever other procedure we're gonna do. But after that, we're gonna continue on with you in this journey. We're gonna make sure that you can wrap your head around what just happened. He has to hear about this all the time, and I'm like, what do you think about this idea? What do you think about that?
And sometimes there's a basketball game on, and sometimes
That's right.
I actually have a contribution.
Right. Okay, let's go. Let's go. Dada can hang out with you because Mama's got to go. I just saw a 79-year-old lady who has high blood pressure, a blood clot in her leg, and dementia. This patient had a lot of stuff going on. I have to look at my list. So she's 73. She has a pseudoaneurysm of her right groin. She had a DVT in her right leg with an IVC filter. She's had a renal artery stent. She's got high cholesterol, high blood pressure, and now she's coming in because she has orthostatic hypotension and she's almost passing out. So I just saw a 55-year-old lady who has high blood pressure and a family history of heart disease. And I'm about to walk in the door to see a 89-year-old lady who has a history of atrial fibrillation, heart failure, some valve disease, and lymphoma. So I'm going in to check on her heart in the setting of all that other stuff that she's got going on. Especially coronary artery disease, it doesn't happen overnight. It's like a slow decline. So if one day you could walk 5 steps and say a week later you're only able to walk 4 steps, maybe you're like, oh, that's not that big of a difference. And really, once patients get fixed, they're like, oh my gosh, I feel so much better. I didn't actually realize how crummy I was feeling. With Sheila's story, I think, again, the point is she thought, well, I'm seeing my doctor, I'm not having any chest pain, I'm fine, and I think that wasn't the case. And when you dug deeper into her story, oh yes, I'm having terrible throat pain when I walk down the hall. And by the way, I'm super short of breath and I can't do what I was able to do in the past. Those are symptoms.
How you doing?
Hi, my dear. How are you?
Alrighty.
You look darn good. Can I sit?
You want to sit up here? I'll sit up here.
No. I'll sit here. All right. How's your heart doing?
Fine, as far as I'm concerned, the initial thing about not getting my breath and getting tired, that's all gone.
Okay.
And I don't have any problem, walking around.
That's really good. And you feel okay when you're walking around the house?
Yeah, not lightheaded or anything.
That's wonderful. She looks so good for just being a month out. I mean, Robin and I.
Do I?
Yes. Her heart sounds great. Lungs sound great. Leg looks like it's healing very well from where they took out the veins. So overall, she's doing really, really well. I'm really proud of you. You're doing great.
I've had excellent doctors.
You're all set.
Well, you take care. Have a good baby.
Thank
boy?
you.
A boy baby?
It's another boy.
At least you got the clothes.
That's right. We're set. We're set. Thank you. I appreciate it. Good to see
Thank you for everything.
Yeah, I've seen you before.
So do you think I'm better now?
Yeah,
Yeah. Am I faster now? Speedier?
probably ride a hoverboard now.
A what?
A hoverboard.
Yeah. So
You
you
got
want?
me
Do you want
one.
me? Do you want me to ride the hoverboard?
Yeah, you got me one.
I had no clue there was anything wrong with my heart. I had no pains, nothing. It wasn't until afterwards, maybe a couple of days after I got home, that I realized what a quadruple bypass was. It's pretty scary when you think about the whole thing. I mean, changed my diet. I exercise all the time. Keeping up with all these 7 kids is that's my exercise too. That's my treat. That's my gift. They're all my gifts.